Good morning and welcome back to KSNT News here on your Tuesday. We have our KSNT doctor on call, Dr. Tim Borchers here in the studio with what's going around right now. The measles nationwide is a big problem. Good morning.
It is. Now, it's nice that it's not necessarily going around here.
Yes.
What's going around here, of course, is that influenza-like illness, but we spoke about that last month. So this gives us a chance to talk about something different.
Absolutely.
Sure, measles. We keep hearing about these outbreaks. This year alone, 2019, we're not even 2 months in, we've had almost 160 cases of measles,
wow,
mainly Pacific Northwest. We've heard about the outbreak in Washington. Last year, 375 cases, New York, New Jersey. We remember 2015, the big outbreak associated with Disneyland in California.
Yes.
The year before that was a really large outbreak, 675 some cases.
It's a big problem.
Amish communities in Ohio.
So what is it?
So measles, it's a highly contagious viral infection characterized by high fevers, congestion, cough, sore throat, the classic measles rash. The biggest problems are the potential complications of pneumonia and encephalitis.
Okay, and so why do you think it's going around so much right now?
Well, the issue around here is not measles that's starting here, it's international travelers, susceptible travelers are infected abroad and bring it back home, where it can then spread rapidly in these pockets of unimmunized individuals.
Well, in addition to this being just a hot topic in the news in general, it's also bringing up a big discussion about vaccinations, of course, today.
Right. So just a little bit of historical perspective on measles and vaccines. We started vaccinating against measles in 1963 or thereabouts. Prior to that, there'd be millions of cases each year, hundreds of thousands of reported cases, and 400 to 500 deaths every year due to measles and its complications. Because of vaccination, by the year 2000, measles in America was largely eradicated, 99% plus gone.
Wow.
But now that we have larger groups declining measles vaccines, we see it rear its ugly head.
Yeah, so what would you tell the critics then of vaccinations today in terms of the measles vaccine?
Well, sure. As far as reasons that people would refuse it, medical reasons. Now, if someone's truly allergic, you got to give them that. There can be religious convictions. The Amish community in Ohio, the big outbreak last year, New York, New Jersey, that was, I believe, a lot of members of the Orthodox Jewish community. The one that's getting a lot of pushback are the people who just refuse it based on personal beliefs. They're just against it. They think it's wrong. I think a lot of that stems from autism fears. Which of course was based on thimerosal. Thimerosal was a preservative. Thimerosal is not now, nor has it ever been, in the measles, mumps, rubella, varicella vaccine. Thimerosal was removed from all childhood vaccines in 2001, and yet we still see autism rates increasing. There have been many large-scale studies that have debunked the myth of a cause and effect relationship between vaccination and autism.
All right, well, a lot of information there and history behind the measles and the measles vaccination. So thank you so much for being here this morning to help us break that down.
My pleasure.
Help us know what's going around right now with Dr. Tim Borchers here. All right, stay with us. We'll be right back after this break.